I'm Tamara Milagre. I'm a German living in Portugal since 22 years, and I'm a patient representative for hereditary cancer syndromes since I found out in 2008 that I'm a gene carrier of the BRCA1 mutation. So that gives me a very high risk for breast and ovarian cancer. When I got the diagnosis, I looked for somebody else to talk about the many decisions I need to take, but I didn't know where to look at because there was no patient organization. Because the truth is we are under the threat getting sick, but we are not sick yet. So that was a gap I identified in Portugal, and then in consequence I started my own patient organization for hereditary cancer syndromes, for gene carriers and their families. So actually we deal with sick people and also with healthy people. I was searching about data about hereditary cancer because I realized at an international congress in 2016 there are no data about hereditary cancer because it's hidden in sporadic cancer databases. So I was looking around on European level, and in that way I found a European reference network GenTouris, Genetic Tumor Risk Syndromes. And I applied with a motivation letter to Eurordis that I really would like to collaborate with GenTouris because I feel that it will be a game changer and that better times will come for gene carriers. Without data, no knowledge, no development. We are not progressing because of the lack of data. So first of all, and that's a question of sustainability, the main pillar is prevention and early diagnosis. And what we actually have is many late-stage diagnoses due to early onset of disease. And so the person himself and even the healthcare professionals do not pay the respective attention to the first symptoms. So disease advances to a late-stage diagnosis. We have chronically ill people and early death due to a lack of sensitivity for hereditary cancer syndromes. Our ePAG group is really powerful in GenTouris. I think GenTouris is one of the best networks actually because first of all, healthcare providers integrate us as equal partners. That is essential to find the right endpoints of our for efforts. You know, if you work into the right direction, including from the first second the real needs of the patients, so the outcomes will be really valuable. And therefore we have done some patient journeys for the different syndromes. They are a sheet for healthcare professionals take their orientation in the right direction for patient needs. And we also fixed to do a position paper where we want to see our reference network in 2 years. So they really know what our actual needs and demands. Open Academy helped me once again to achieve the consciousness that learning, education is never too much, and we learn each and every day more and more. Nobody is better than the other. It's just a question of education. So take advantage of Academy and take part in it.